Dr. Michael Holland is here, who started the nearly said One Nation, the One Hospital, the One Hospital initiative, which is powering on well, and as such we've got promise of funding from state government. So Michael, would you just like to say something on that One Hospital?
Thank you. I think I've met many people here, and I've met the majority of the candidates. I was the principal petitioner for a petition that went to New South Wales Ministry of Health last year for two purposes. One was for an immediate improvement in the current accident and emergency critical care services and perioperative services, as well as the secondary part of the petition was to develop a single new regional base hospital for the Eurobodalla with services equal to those of our nearest regional and base hospitals, that is South East Regional Hospital and Goulburn Base Hospital. On the 31st of October, the New South Wales Government committed to $150 million to developing a single new regional hospital, and the clinical service plan is proceeding along that. We have not had a response from the state government for immediate improvement to any of the services, and neither have we a commitment to the fact that the new hospital will be a level 4 hospital equal to the other regional base hospitals. The rate limiting step in developing a hospital like that is to have intensive care services in a regional base hospital, in which case all services within that hospital, including surgery, intensive care, medicine, paediatrics, obstetrics, mental health, will all go up to a level 4 service. So my additional question is how the candidates would guarantee or contribute to federal commitment to guaranteeing a level 4 hospital in the region. Thank you.
Thanks, Michael. Okay, we'll go from this end back there. Here's the mic. Can everyone hear at the back okay? Fine, thanks.
Okay, well look, it's great to be a part of this community, which I have been for years. As a result of that, I've been able to be part of the One Eurobodalla Hospital quest right from the beginning. So I have attended a number of consultation sessions that the community's been a part of and that the Eurobodalla Health Service has run. So I think that's really important. I've also spent a lot of time here talking with people and have been amazed at the amount of people that have had to travel outside of the area to go to Canberra, to go to Nowra. It's really just mind-blowing, and I think it's about 2/3 of patients that have to travel away, which should not be the case. I would like to say that I have had good discussions with the Shadow Minister for Health and Medicare, Catherine King. Actually, Catherine was in the Gilmore electorate just today. And as a result of those discussions, Federal Labor has committed $25 million towards the new One Eurobodalla Hospital. And that specifically, we really want to see, we want to make sure that we have those services there, as Dr. Holland has said, a level 4 hospital. But we're particularly concerned about mental health, inpatient beds, because we know that is a huge issue as well. So we have made that contribution. But we've also made a number of other contributions as well. Bill Shorten came to Maria recently and we announced a radiation therapy facility for the Eurobodalla. So again, that will mean that patients will no longer have to travel to Canberra or to Nowra for radiation treatment. We've also just recently announced at the other scale for youth mental health, a full headspace facility for Bateman's Bay, so that will actually help provide, prevention strategies to help our young people from the age of 12 through to 25. So all of these types of things are aimed at improving the health services in the Eurobodalla. We've also committed to a new MRI licence for the area. A cancer care package that we've announced in the budget, which is greater assistance to remove the costs for scans, to help with out-of-pocket medical expenses for cancer patients, and to have more cancer medicines on the PBS. We have, of course, similar to before the last election, committed to unfreezing the Medicare rebate to help with out-of-pocket medical expenses. We're also increasing the growth in hospitals funding, and that's really important so that the states have additional funding so we can actually have more nurses and doctors and the staff where we need them. And just yesterday we announced our pensioner dental plan, which will ensure that aged pensioners and people that hold a Commonwealth Health Seniors card can access $1,000 in dental treatment every 2 years. So there's some 32,000 pensioners that will actually benefit from that pensioner dental plan. It's a great extension to Medicare and something that we're really proud of. So in answer to your question, I will definitely fight for health services in our community. I'm part of this community, and talking with people in this community, I know how important it is. I know when I knock on doors in this community what people tell me. They want to be able to access more health services closer to home. That's what I'm committed to. That's what Labor's committed to. Thank you.
Thank you very much for that question, Dr. Holland. I've corresponded a couple of times with you, and I think probably the short answer is yes. Look, you've absolutely nailed it. I talked briefly to the doctor just on the issue of level 4 hospitals, or as I call them, more a district hospital model. The issue that you identified is that watering down and removal of services. I've seen it here, I've seen it in Shoalhaven Hospital as well, or Shoalhaven District Services, I should say. What happens is you get on a knock-on effect. As you remove a service, then another service suffers, which becomes justification for removing that. So you see an overall erosion of the services that are available for people, and again, as a number of people will point out, they have to travel to Canberra, to Wollongong. Even Shoalhaven Hospital doesn't have all the services there. I had an unfortunate circumstances brought to my attention where they tell me that they don't have a forensic qualified doctor, so if they have a rape victim presented Shoalhaven District Hospital, they are often put in a taxi and sent to Wollongong for that. Now that is an appalling situation that we don't have those services. But again, the problem seems to be that there is a general approach of running hospitals as a business, and I don't mind that concept loosely. But it's not about saving money, it's about providing services. You're allocated a budget, you use it efficiently, as you should. But by geez, you shouldn't be cutting services, so you can put it on your next CV and say, I saved $20 million at XYZ hospital and get yourself another job where you do the same. It's not good enough. So I absolutely agree, and certainly that issue of running down services is a particularly relevant point for us. In fact, my wife's brother was born in Milton Hospital 30 odd years ago. He was the first child born under then the new Shoalhaven City Council, so we've got quite a link going back. But that service is no longer available. So again, it's that erosion of services. So how will I commit to maintaining, in fact improving? I can tell you what I can do. As an independent, I'm not bound by a party. I don't have a party saying to me, look, that's not part of our policy. We want to put this money somewhere else. You can't do that to me. I'll be standing up, I'll be fighting for you, and I won't be driven, I won't be influenced, and I certainly won't be controlled by faceless men and women in our capital cities who don't know about regional Australia. So that's what I'll be doing, and I will be making plenty of noise, as I already have. So that's what I'll be doing. But thank you very much. Thank you for your question, Dr. Holland.
Thank you, Dr. Holland, too. Just a couple of things I'd like to clear up. Would this be considered a trauma hospital? Does that mean that people won't be flown to Canberra if they're been involved in a car accident that's actually highly, like how high level is level 4?
Well, at the moment, we have zero self-sufficiency in orthopaedic trauma, I've been myself involved with an unfortunate accident where we left Braidwood and I made the mistake of saying to my wife, it's been a good trip so far, and then about 5 minutes out of Nelligan on the side of the road is a car turned over with bodies lying everywhere in one ambo. Now, to the credit of our health service, it felt like 5 minutes and a helicopter landed at either end of the road and to come and pick people up. But you've only got to drive from Nowra to Maria, Maria to Bega. A lot of blood can be lost in an hour and a half. So we need the services. The first part of health policy is need, and you can't deny the fact we have that need here. If we have zero paediatric services, zero orthopaedic services, and only 25% of our adult mental health services are dealt with locally.
So this new hospital would cope with that. That's
Yes.
the level. Yeah, and stroke. Sorry, before you sit down, stroke. At the moment, the regions don't have access to the immediate intervention after a stroke to prevent long-term outcomes being difficult.
So hospitals are becoming increasingly less surgical in their treatment. A lot of things are done through interventional radiology, and again, most of these services are very time limited. If you don't achieve that within a critical period of time, it doesn't get done. We actually have well-trained radiologists that would be capable of doing those things here, but you need a dedicated interventional radiology suite to satisfy that.
But you hope to have that. So that would be a very good thing, especially with the age and stage of the population.
The question is, what are you going to do about it?
Yes, no, I was just wondering, what was a level 4 hospital, that's all. I'd just like to thank Labor for bringing dental into the picture. Sadly, we wouldn't think it's enough. We actually would like full dental under Medicare. It's a part of our body. It's tied in very closely to cardiovascular disease when there's bad dental health, and we need to bring it under the same umbrella as Medicare, 100% for everyone. And also, even at the moment, they're not including New Start people, or New Start and other concessions, which is a bit of a shame. People who are unemployed find it very difficult if they can't afford to go to the dentist. Fortunately, we do have a clinic in Nowra Hospital, which is catering, but it's already filled up. 8 new chairs, 4 people on pensions and concessions, but we still need that across the country, 100%. Also, I'd like to say we would accept the hospital. The Greens actually maintain that for too long we've had all these bust and boom, wonderful resource times where there's been loads of money made to the country, royalties and so on, but health has not kept pace. Well, lots of things have not kept pace, but hospitals and health, especially in the regions, along with education, have not kept pace. We should have had a hospital like this a long time ago. Nowra is the same. It needs a new world benchmark hospital, and that's what we expect. And of course, the health system, as we all know, is a bit of a 2-tiered system. If you need to go to a specialist, you have to have $200 to $400 in your pocket up front. So those kinds of things should all be available in a hospital like that to the local people who can't afford to pay to specialists who charge those amounts. We would also like to set up an independent independent prevention health commission, because really we should be looking at prevention as well. We need to invest in hospitals, especially in the regions. And of course, some of the suburbs in Sydney too are really in dire straits. And so our aim would be, let's look at health, diabetes, cardiovascular disease. Let's try and prevent more, and so that we don't have such a high demand for the hospitals as they are.
Thank you.
Thanks very much, and thanks Dr. Holland for your descriptions. It was great to meet with you a couple of weeks ago, together with Bridget McKenzie, who's the Deputy Leader of the Nationals and the Minister for all things regional, and to actually have a good look at Maria Hospital and see the current state that it's in, so I thank you for that visit. Yeah, it's interesting, the first 10 years that Labor was in government in New South Wales, we lost 50 maternity services across regional New South Wales, 50, including the hospital that I was born in, yes. So it shows that you can't trust Labor in government. And I'm just reading the paper here.
Respectful.
Very respectfully. But just looking at the paper today, the promises made by Bill Shorten over the last day or so are actually going to cost $35 billion. Now, what I say is important.
Katrina, just answer the question, please, or we'll be here all night.
Absolutely. But $35 billion in promises over the last 24 hours is a lot of money. Now, Mr. Mr. Adjudicator, Mr. MC.
Yes, just answer the question, please.
Absolutely. Look, I couldn't give more support for Michael Holland and all that he's trying to do to gather 3,000 signatures as quickly as you did to be able to present to the Premier last October was absolutely outstanding. I've seen the condition of the current hospital. Yes, you need a great new hospital, and it needs to have all the services that you believe are important for this region. If I should be fortunate enough to be elected in this electorate, I would do whatever I could to support you to get those services that you want in that new hospital. $150 million has been set aside by the state coalition government, with Andrew Constance there as the member. I worked with Andrew for 14 years in state parliament. I know him very well. I worked very well with him. We're in cabinet together. And I would look forward to working side by side with him to make sure that you have the very best hospital that you possibly could.
Thank you.
Michael, if I may ask, the current hospital at Maruya, probably the best, what level is that in your view?
Role delineations are determined by New South Wales Health, and it's a rather complex document where one service leads to another. But Batemans Bay Hospital would be categorised as a level 2 hospital, and Maruya would be categorised as a level 3 hospital, although in practice these are guidelines and we have to quite often punch above our weight to do services that are actually level job in that, but it leaves us in a vulnerable situation trying to provide that care.
Hold the mic if I may, please, Mike. The next question is, what's the cost difference between, we know that the state has put up $150 million for the hospital. What's the cost difference to make it a level 4 properly? And then what's the cost difference to make it a level 5? Approximately.
Demographically, we don't need a level 5 hospital.
At the moment, I agree.
At the moment.
Yep.
And that demographic extends to a 20, 30, 40-year plan. So level 4 will satisfy our current and future needs. My only comparison is that the South East Regional Hospital at Bega was developed with $187 million some 10 years ago, and factoring into CPI and inflation, I don't believe that we could get the same service in 5 years from now at $150 million.
Yeah, that's what I was trying to get to, and thank you for that, Mike. Thank you. Yeah, so the gesture of the 150 is a good thing. It's a good start. And so really what you're saying is you're probably short. We're short another 50 million to achieve a level 4. Okay. Okay. Look, ladies and gentlemen, I'm not in a position to promise you anything other than to do my best. As Grant mentioned earlier, and I'm sure all these other good people that are here beside me really have a genuine, and I'd like to think sincere, wish to move our area forward. Let's be brutally frank. The area is growing. That I observed, and I'm sure all you people here have observed the same thing. Our services have diminished, there's no question. To think that our doctors have to scream out loud to get these services because they're at the cold face of what they experience through you people. We live here, we've enjoyed paradise, it is a beautiful place, but the area will grow. And we need to address the future, and that means that we have to have a better medical facilities, dental, absolutely, and we need also to protect, from what I'm hearing, our people that work in the hospitals, because they've been subjected to some fairly unpleasant issues with regard to drug addictions or whatever the case may be. And I've had some people approach me to say that they're very nervous to go to work to help, and they are special people, let's be honest. They are special people that help in hospitals, nursing homes and all that sort of thing. So no promises other than to do your best, and I'd certainly do that. My record stands on that. But at the end of the day, until you're in a position to do something about it, and like a couple of colleagues have mentioned here earlier, you've got to be in the position to scream loud and be consistent. But I believe that if we have a balance and we have the facilities to have good representation for our area of Gilmore, I'd like to think that we will move forward, and I'm genuinely of the opinion that we can improve this. We must do, because it's done nothing but deteriorate.
Thank you, Milton.
Thank you.
First of all, is that to be able to afford a health system, to be able to provide the services that we need within these communities, you need to have a strong economy, you need to have a balanced budget that can do that. In the budgetary round that was just announced by Josh Frydenberg earlier in April, there's something like, Medicare being boosted by $6 billion, with $1.1 billion for primary care. You're looking at hospital funding being boosted by $5 billion on top of a new $1.25 billion community health and hospital package. You've got $40 billion going in for life-saving and life-changing medicine provisions in the forward estimates. You've got $5 billion for a 10-year medical research fund, future fund investment plan, and you have $736.6 million of mental health, including youth suicide programs. You also have $1 billion going for Indigenous health. We have a large Indigenous population down here, something like 5%, which is larger than the state average, and also over $1 billion for childcare services. So what does that mean for the South Coast, for the Yillawalla down to the Victorian border? Well, that means an over 200% increase in funding for hospital and health services down here. And so what that means also in regard to the PBS scheme is an actual 8,000 extra people in the Gilmore electorate who will be able to access the PBS scheme at a very more reasonable and cheaper prices. What does that mean for the question in regard to the hospital, and that is a very strong commitment from the government in regarding to upgrading and working towards the developments of the hospital down here, but not only the hospital here, but also at the hospital services across the Gilmore electorate to ensure that they're getting their funding. Now, if I'm elected on the 18th of May, my task is to have outcomes. I'm a person in business that doesn't like to just sit around and talk about philosophies and what wish list and all that type of stuff. It's about outcomes and it's about deliverables. And so we will be working very close with our Minister, Greg Hunt, on getting those funds and driving that forward in regarding to getting the proper health services that we need down here, but doing it in a proper, structured way. And I'll give an example of how we did that previously with the Princess Highway, but that's a question coming up, and I'll answer that question then. Okay, thank you.
Thank you, Warren.